Rethinking Fabry, curating your care team, building a network of doctors to help manage your Fabry disease. Do you have the right people on your team? We asked some leading doctors who specialize in Fabry disease for insider tips for building a better healthcare team. What kind of specialists might be missing from my care team?
The most important systems in the body for Fabry disease include the heart. So obviously we want to pay attention to that one. So you probably need a cardiologist.
It's not just about what your heart is doing. It's about how is your heart functioning.
We need people that can interpret echocardiograms, which show the structure of your heart. Know when to order a cardiac MRI study, which shows even a better detail of what's going on.
Kidney disease is greatly increased in people with Fabry disease, and most people would need a nephrologist, a kidney doctor.
We need somebody that checks the protein in your urine and the creatinine routinely to make sure and looks at not only the absolute value, but the slope of the kidney function. Neurology, you may or may not need to see immediately. Seeing neurology might be appropriate to help with the pain management.
Numbness, tingling, weakness, loss of vision, all those sorts of things that are concerning for neurologic involvement, we would want to know about.
And I have a neurologist look at their brain and assess for any possible strokes. And we do that once a year. When it comes to the different specialists that are involved in taking care of Fabry disease, so you really do need a ringleader. Ideally, you'll have a geneticist like myself that's involved in your care who can help coordinate the care to the other specialists for you.
Geneticists are the specialty that looks at the whole body that's most likely to be familiar with Fabry disease. We also have a list of things that we kind of keep track. We have labs that we do, we have studies that we'll get on a regular basis.
Wait a minute. What about my primary care doctor? Where do they fit in?
The primary care physicians are really important. They see the patients more regularly than we do, and they deal with the health of the patient outside of the direct impacts of Fabry disease. You know, what you're really looking for in your primary care physician, but also the other doctors that you work with, is someone who will listen to you, take what you're feeling seriously, and who will learn about the parts of Fabry disease that they are needing to deal with.
The way that the family doctor can really be involved is if they have an open line of communication with the Fabry specialist.
How do I get my doctors to actually talk to each other?
So it's not just kidney, brain, heart. This is a multi-systemic disease, and if we just have to approach it that way, where you see everything.
We have to make sure that, for example, if I see a patient and I'm concerned about something, I have to contact the cardiologist or the nephrologist or whoever is going to be dealing more specifically with that symptom. Likewise, they need to contact me, and we need to have open communication. The patients often will participate in those discussions as well. In my mind, the patient is as central as anybody on the team. And I tell my patients up front that a year or two into their treatment, they're going to know more about Fabry disease than most of the doctors they see, and that they should embrace that. I cannot get into the patient's mind or understand what it's like to have Fabry disease, but they can, and if they can share that with me, I'm gonna know more about what their needs are and what I can do or what I need to pay attention to in order to help them.
I'm not sure where to look for doctors who really understand Fabry. How do I get started?
Some of the ways you can find these Fabry specialists is by working with Fabry support groups. Looking through the Fabry support groups and saying, this is someone who's not just a nephrologist, not just a cardiologist, not just a geneticist, but this is a Fabry doctor. So the Fabry support groups really know who the specialists are.
Check out the National Fabry Disease Foundation and Fabry Support and Information Group to jumpstart your search for specialists and network with Fabry experts and people living with Fabry. Finding a Fabry specialist to help coordinate treatment and communication with all of the doctors on your care team can help set you up for success. And don't forget, you are the specialist in how Fabry affects your daily life. Playing an active role in your disease management can also help ensure that you receive the best care possible.